children between the ages of 12 and 17 will be able to get one shot of the Pfizer Covid-19 vaccine from next week. Health Minister Dr. Phaahla said registration for children on the electronic vaccination data system will open on the 20th of October. We speak more on this. I'm joined by Dr. David Harrison, Head of Acceleration Strategy at the Department of Health. Thank you for your time this afternoon. Perhaps a reminder of some of the considerations that were taken when this decision was made.
Good. Thanks very much, Dudu. It's great to be on the program. So we need to understand that younger people are at much lower risk of getting seriously ill or dying from COVID. And so this is not the strategy to significantly reduce death and disease in South Africa. And that's our priority. But secondly, what we have to do is try and get as many people in South Africa vaccinated so that we can build up what we call this herd immunity. We can get to a point where it's very, very difficult for the virus to find somebody who's not vaccinated. And so that's part of the second strategy, extending vaccination to a younger group of people to make sure that we have as many people as possible vaccinated. And it partly arises from the fact that we have not seen as many older people, even the 18 to 34-year-olds, coming forward for vaccination at the numbers that we require. And so we're seeking to just expand the pool of people in South Africa who, if they're willing, can come forward for vaccination.
The issue of consent, that 12 to 17-year-olds do not need parental consent to get this vaccination, has deeply divided society, right? So with some people arguing that anybody under the age of 18 is a minor and they need their parents. So why is it that in this instance they do not?
Well, the good thing is it's not in this instance. I mean, the law in South Africa, the Children's Act, has made provision for children from 12 and above to make their own decisions around medical treatment. That's already in place, and especially when you have a medical intervention like this that is so positive, is so safe, it absolutely makes sense to apply the law in this case. And so it's been done, and the basis of that law is that children aged 12 do have the capacity, in general, for the vast majority of children, do have the capacity to make autonomous decisions over their lives. And it's respecting that. That's why the law is in place. And in this case, a vaccination, which is just like any other vaccination that we conduct in South Africa for children, for teenagers, and for adults, it's just the same. So this is not exceptional at all. It's quite the norm, and it's been in place now for a number of years.
Let's look at this, right? So how do we capacitate parents to have a conversation with their children? So you will find a parent that says, well, you will not do this, or you'll find a parent that says, you have to do this, even though a child says, I do not want to do this. So how do we then capacitate parents to have a conversation with their children? Where do they even start? In both scenarios, I guess.
Yeah, and I think the first place is for parents to really get to grips with understanding the COVID vaccination itself. That's your first responsibility as a parent. And to derive that information from credible sources. Make sure that where you're getting those sources from are conveying information that is sound, that you have the facts. And we know what those facts are. Those facts are that COVID vaccination is incredibly safe, hugely protective, and is making a massive dent in death and disease in countries that have got high vaccination. So that's the starting point, is just to make sure that you as a parent fully understand what vaccination is about, that you're able to convey that to your children. Then I think the second thing is to assert the rights and the autonomy of your child to make their own choice, one way or the other. And I think that's the next step when you talk to your children, is to convey the fact that it's their choice. And then, as I say, to convey the fact that it's safe, that it's the same as any other vaccination, and to respect the decision of your children. If they decide to be vaccinated, there is a huge case, as I've said, for vaccination. Allow them to do that. If your child is not convinced, then we all have to respect that. And I don't think we should be forcing anybody in South Africa to get vaccinated against their will.
Dr. Harrison, the school of thought that says you speak of rights and autonomy of children to make a decision on this, right, without needing the consent of their parents, given that you don't even get an ID book until a certain age here in South Africa, given that you're not even able to purchase certain things until a certain age, how far, shall we go with that argument of autonomy and giving children rights? Why should it not apply to everything?
Well, as I said, I mean, this is a debate that has been held in South Africa over a number of years, and consistent with many countries around the world. The consensus that is now enshrined in law is that children aged 17 and above have the right to decide on their own medical interventions. That's what's in place. And so what is happening here is a simple application of processes that are in place already. And I think, I think our starting point sometimes, and just listening to the argument, our starting point has to be an understanding that vaccines are unbelievably safe, that they are far safer than a child getting COVID infection. That is the starting point. And so I think to start with the premise that we're doing something risky to children is the wrong premise, because it's not true. We allow our children to go to school. The vaccine is safer than doing that. We allow our children to cross roads in South Africa. The vaccine is far safer than allowing our children to do that. We don't require a signature to enable our children to cross the road. So when we're applying it here to something that has a significant benefit to both the child and to broader society, I just don't think that we should be seeking to apply a set of rules that apply in the context of something that we would regard as highly hazardous. Vaccines are not.
Right. Perhaps a final word to young people, right, from yourself, who are really not sure where they fall on this debate of getting vaccinated or not. You speak of the minimal risks that are associated to getting vaccinated, even though there's still more research to be done about this. What would your word to these young people, who some might be anxious and some might be, excited and looking forward to it?
Well, my advice as a medical doctor and as somebody who has really considered all of the science is to go for it for the reasons that I've cited here. There's a tiny percentage, particularly of young boys, who gets a mild transient inflammation of the heart that goes away. But that is an absolute minority. Compared to the number of people who get inflammation of the heart from COVID. So the benefits are there. And so the request to young people as well is to respect their ability to process information. And so the responsibility on them is to fully acquaint themselves with the facts as well. And on the basis of that, make the choice that they believe to be right for them.
Dr. David Harrison, a great pleasure being in conversation with you this afternoon. He's the head of Acceleration Strategy at the Department of Health. Thank you.